There is a type of implant that can help increase both the length and thickness of the penis. After I shared my previous video about ways to improve penis size, I got a lot of questions specifically about the Penuma implant. Interestingly, I first learned about this implant during a national medical conference last year. I haven't personally performed this procedure, but I wanted to explore it more deeply so I could provide you with clear and helpful information. I'm Dr. Rena, a urologist and pelvic surgeon, and if you find this content helpful, be sure to like the video and subscribe to the channel. In this video, we'll go over what this implant actually is, who may be a suitable candidate, what research has been done so far, and what potential risks are involved. The Penuma implant is made of soft, medical-grade silicone. It has a sleeve-like shape and is placed along the sides of the penis to enhance both length and girth. So, who is it meant for? Typically, it's designed for individuals who are looking for a different cosmetic appearance, those who may have irregularities or indentations, people with a retractile penis, or anyone with certain structural concerns affecting the penis. Before undergoing this procedure, several in-person evaluations are required, including both physical and psychological assessments. You'll also need medical clearance to ensure you are fit to safely receive anesthesia. Your doctor will review your history, including whether you've had any prior penile enlargement procedures. In general, studies have shown that individuals who previously underwent enlargement surgeries did not respond as well, and outcomes were not as favorable. Because of this, they are often not considered ideal candidates. Another requirement is that you must be circumcised. If you are not, circumcision must be completed first, followed by proper healing before moving forward with the implant. Doctors will also carefully examine the skin for any abnormalities, check for scar tissue, and look for factors that may interfere with healing, such as smoking or certain medications that can slow recovery. From a psychological standpoint, it's equally important to ensure that anyone considering this implant has a healthy mindset and realistic expectations. Patients are often asked to use specific rating tools to express how they expect their penis to look after surgery, helping determine whether those expectations are reasonable. In addition, a series of standardized questionnaires are used to screen for conditions like body dysmorphic disorder. As I mentioned in my previous video on increasing penis length, individuals who struggle with concerns like small penis anxiety or conditions such as body dysmorphic disorder often report lower satisfaction and less favorable outcomes after surgery. Now, this implant has actually been examined and published in scientific studies. In one such study, researchers looked at 400 patients who had the procedure performed by a single surgeon between 2009 and 2014. They measured penile circumference along with levels of satisfaction, self-esteem, and confidence before surgery, and again 6 to 8 weeks afterward. Out of those 400 patients, around 300 were followed for as long as 6 years to reassess these same factors over time. The results showed that the implant increased penile circumference by about 1.9 inches or 4.9 centimeters. That's nearly a 57% increase from the starting measurement, which is quite significant. They also found that self-esteem and confidence scores improved by about 83% within 6 to 8 weeks after the procedure. Among those who were followed between 2 and 6 years, those scores remained higher, with an increase of around 72%. While these findings may sound encouraging, it's important to look at them carefully. This study was conducted by just one surgeon at a single location. So the question becomes, would these same results apply if the procedure is done by a different surgeon, especially someone with less experience? At this point, we simply don't have a clear answer. Now let's talk about potential risks. In this study, the reported complication rates were relatively low. Fewer than 5% of patients developed a seroma, which is a buildup of fluid beneath the incision. Less than 5% experienced noticeable scarring, and under 4% showed signs of infection. Overall, the outcomes in this particular study were quite positive. Thank you so much for watching, and always remember to take care of yourself, because you truly matter.